Okay, we talked about the conductive hearing loss in our first section, and now we will talk about the sensory neural hearing loss, the another type of hearing loss. And in conductive, as I said, it's mainly due to obstruction in the conductive pathway, and sensory neural, as the name shows, is more in the sensory and the neural pathways of the hearing. So in this, when we will talk about the sensory neural hearing loss, we will talk about the causes of sensory neural hearing loss, how we diagnose and diagnosis and management of sensory neural hearing loss. So sensory neural hearing loss and its management. In this, as I said, in the conductive hearing loss, there is negative Rennie test. Negative Rennie test means the air conduction is less than the bone conduction. But in sensory neural, since the conduction pathway is not affected, now it's positive Rennie test. And when positive Rennie test, the air conduction is more than the bone conduction. That's the normal conduction. So air conduction is more than the bone conduction. There is, in Weber test, the sound is lateralized to better ear. So as compared to conductive hearing loss, in which the sound is lateralized or voice is lateralized to affected ear, in this it's lateralized to better ear. Bone conduction reduced on Schwabach and absolute bone conduction test, and more often involving high frequencies. If you remember, we said that it's in conductive hearing loss, it's more low frequencies are affected. So in this opposite, high frequencies are affected more often. No gap between air and bone conduction curve on audiometry. If you see here on audiogram, this is the hearing loss in decibel, and this is the frequency in hertz. High frequencies are affected. So if you see, when the frequencies is about 8,000, it's affected more. The sound is, its hearing loss is about 75 to 80 decibels. So more high frequencies are affected, and hearing loss is more in high frequencies. In 4,000, it's about here, you can say close to 60, 58 or so. Similarly, in 2000 hertz frequency, it's about 40 decibel. So in this audiogram, you can see as the frequency is increasing, the hearing loss is affected more. Loss may exceed 60 decibel. So exceeds 60 decibel. Here you can see in about 8 frequency, 8,000, it's about 75 or 80. So it's more than 60 decibels. Speech discrimination is poor, and difficulty in hearing in the presence of noise. If there is a quiet environment, hearing may be little better, but if there is a noise, hearing is affected more. Now, the causes of sensory neural hearing loss. Etiology is congenital, and congenital is by birth, usually by anomalies of inner ear or damage to the hearing apparatus by prenatal or perinatal factors. So congenital are the defects present at birth. So it can be due to any damage to the inner ear in the prenatal or perinatal period. Acquired causes of sensory neural hearing loss can appear later in life. They are not congenital, usually infections of labyrinth or inner ear or trauma to the labyrinth or eighth cranial nerve. Maybe due to noise-induced hearing loss. All these are the causes of acquired hearing, sensory neural hearing loss. Ototoxic drugs, different drugs are toxic to the ear, and that toxicity can cause hearing loss, and that is mainly sensory neural hearing loss. Then we have presbycusis. We will talk later on about what presbycusis is the hearing loss due to aging. Meniere's disease is another ear problem that can cause a sensory neural hearing loss associated with tinnitus and vertigo also. Acoustic neuroma is the tumor is the tumor. Sudden hearing loss can be lead to sensory neural hearing loss. And then familial progressive sensory neural hearing loss. And some systemic disorders also lead to sensory neural hearing loss. So all these are the causes of sensory neural hearing loss, which can be congenital or acquired. Congenital is due to problems in the inner ear in the prenatal and perinatal period, and the acquired are different, can be due to drugs, infections, neuromas, presbycusis, Meniere's disease. Next, diagnosis. Diagnosis of sensory neural hearing loss can be due to history, very important, different factors like infections, any trauma, any injuries, history of any neuromas, all that can be asked in the history. Any severity of deafness, how bad is the hearing loss? Type of audiogram, site of lesion, and lab test. So diagnosis is based on all these: history, lab test, and different audiogram which is performed. This is the inner ear, cochlea. So sensory neural hearing loss mainly affect the inner ear, cochlea, and the nerves and central auditory pathways. Next, the management. These are the different types of hearing aids available for hearing. Management is early detection. Syphilis of the inner ear. Syphilis can lead to sensory neural hearing loss, so that should be managed. Serous labyrinthitis, if there is inflammation of labyrinth leading to serous labyrinthitis, it can be managed. So all these are the different problems that can lead to sensory neural hearing loss, and they should be managed accordingly. Ototoxic drugs. If somebody is taking drugs which can cause ototoxicity, if they should be stopped, sometimes the damage is irreversible, damage is already done. So it's always good to diagnose early detection that these drugs are causing problem or preferably should be avoided. So that was all about the sensory neural hearing loss, different causes and management, and how we can diagnose sensory neural hearing loss. Thank you for watching sqadia.com.